The COVID vaccine and Juvederm creating crazy reactions? I'll explain. Today, we are talking about adverse reactions that have occurred with dermal fillers and the COVID-19 vaccine. I get a lot of questions like, is it safe for people with fillers to receive the Pfizer COVID-19 vaccine? What about the Moderna? And what should I do if I have fillers and want to get the vaccine? Will I have a reaction to the COVID-19 vaccine if I have fillers? Not to worry. Today, I'm going to go over all of that, and you are definitely going to want to keep watching. Hey everyone, I'm Dr. Jordan Wagner. I'm an emergency room doctor who treats everything from COVID to gunshot wounds, burns, you name it. I've created this video series to help answer your medical questions and the questions I get asked every day from patients. All right, awesome. You fall into the category of getting priority for the COVID-19 vaccine and finally just scheduled your appointment online. But stop. Consider this. Have you recently received any fillers, such as Juvederm, within the past few months? If so, you may just want to put that vaccine appointment on hold. Yup. As the medical community keeps a close eye on the rollout of the COVID-19 vaccines, some are noticing reports of various skin reactions, particularly among people with dermal fillers in their face. And according to the Food and Drug Administration, aka the FDA, the vaccine may cause side effects for people with cosmetic facial fillers. During a meeting of the Vaccines and Related Biological Products Advisory Committee in December, the FDA reported that 2 people with dermal fillers experienced facial swelling after receiving the Moderna's COVID-19 vaccine specifically. In both cases, the cosmetic fillers were injected sometime before receiving their vaccination dose. That's why today I'm diving into some of your questions about the COVID-19 vaccine and facial fillers. How does the COVID-19 vaccines potentially cause side effects for individuals with fillers? Great question. But before I totally dive into that, it's helpful to understand how vaccines actually work in our body. Past vaccines injected dead or disabled viruses into the body to create an immune response that provides protection against the live virus. They chose dead or disabled viruses because they are designed to be incapable of causing severe disease. Whereas the COVID vaccine, or now the mRNA vaccines, instead teach our cells how to make a protein, or even just a piece of a protein, that triggers an immune response inside our bodies. So, back to the question at hand. How does the COVID-19 vaccines potentially cause side effects for individuals with fillers? It is believed by experts to be an inflammatory reaction. You see, a filler is a foreign body, and when your immune system is ramping up and turning on due to the vaccine, it would make sense that areas that have foreign bodies that aren't normally in our body would also have inflammation. This is because your immune system is designed to counteract any foreign substance within your body. And it's not the COVID-19 vaccine only that might trigger this reaction. Viruses like the common cold, influenza, etc. can also trigger swelling. This is because your immune system is being activated. All right, next question. I have fillers and I want to get the COVID-19 vaccine. What should I do? As always, speak to your doctor first. If you have a history of allergies or reactions, especially to vaccines, it would be wise to speak to your primary care doctor to see if it requires you to have an EpiPen around just in case of a severe reaction from receiving the vaccine, or any vaccine for that matter. Another question. When can I get the vaccine after getting fillers? It depends on the individual and the type of filler. Most fillers begin to resolve the residual amounts by about 6 months or so. Of course, some sooner, some later. I would check with your dermatologist or plastic surgeon who placed the filler in terms of the duration or how long your filler is supposed to last. It really depends on what kind of filler and how long it's been in your body in relation to the vaccine. If you're someone who normally gets filler and are planning on getting a COVID-19 vaccine soon, some experts believe that you should try waiting 2 to 4 weeks after the vaccine before going in for your touch-up filler appointment. Also, remember that the vaccine is thought to be most effective after both doses, so it may be wise to wait until getting the full course before having any additional fillers. Can you dissolve fillers and then receive the vaccine? Filler dissolving is a treatment that can be used by administering another injection into the area you've had fillers to quickly break down the dermal filler. The treatment works by injecting hyaluronidase, an enzyme that exists naturally in your body already, into the filled area such as the lips. This is another route to consider, but could be costly. Before making any decision, make sure you reach out and speak to your primary care physician on whether you're prone to vaccine reactions before making any decisions. If you do experience side effects, what should you expect? The primary reactions that have been experienced thus far are facial swelling and redness of the area. When receiving the COVID-19 vaccine, medical personnel administering the vaccine are advised to make individuals wait 15 minutes, a half hour, or longer if there's a history of reaction to make sure that there are no adverse reactions. If by some reason you do experience a reaction, you'll be administered an antihistamine. When the immune system has a cold or an illness, the body reacts with histamine, which causes flushing, swelling, and a runny nose. So antihistamines treat that directly in terms of symptoms, whereas difficulty breathing and tongue swelling are indicative of a more severe reaction. If you have cosmetic fillers, allergic reactions, or sensitivities, it is important to tell your healthcare professional administering your vaccine, and if it applies to you, bringing your EpiPen with you to the visit. In the 2 cases where patients experienced side effects and reactions after receiving the Moderna shot sometime after getting fillers, the side effects were not life-threatening, and all these cases were resolved fully with steroid medication and antihistamines. I encourage everyone to become vaccinated, and I myself have already had both doses of the Pfizer vaccine. But the take-home message here is that yes, there are rare reactions with the vaccine and fillers, but we know what they are and they can be managed. At the end of the day, it's more important to get the vaccine than looking good with your facial fillers. And until the majority of the population is vaccinated, we're all going to be walking around with face masks to hide our faces anyways. So consider that. Alright, that's been a quick COVID-19 vaccine and filler conversation with me, Dr. Wagner. Did you get the vaccine? Have you had any reactions? Comment below. I'd love to hear from you. Specifically, if you've had fillers, I'm curious to see if you've had any facial swelling or whatnot. And also, are there any COVID-19 concerns that you'd like to see me make a video about? Please leave me a comment below. And please make sure you subscribe and turn your bell notifications on. When you do that and hit the like button, you're letting YouTube know that you'd like to see more videos like this one. Thank you so much for watching, and stay healthy, my friends.